Sexually transmitted infections, or STIs, are awkward to talk about, but it's so important for us to learn about them and to know how to prevent them and how to protect ourselves. Hello, I'm Micah Terrell with 91.9 Public Affairs and APSU TV. You probably did not know that Clarksville and surrounding areas are seeing an increase in STIs. And joining me with more on this is Dr. Heather Phillips. She's the Director of Laboratory Testing here at Austin Peay, and she's also an Assistant Professor of Medical Laboratory Science. Heather, thank you so much for stopping by.
Thank you for inviting me.
So first, let's talk about the terminology a little bit, because some people may not be familiar. When we're talking about STIs or STDs, what's the difference between those?
So when we're talking about an infection, we're simply talking about, so infection as far as the term sexually transmitted infection, we're referring to the infection of or a cause by a bacteria or a virus, which is causing an immune response within the body. When we use the term sexually transmitted disease, over the whole scheme of things, we're referring to the same process happening, but some people like to consider STD or disease a process caused over long term. So it's referring to an actual disease process happening in the human.
Got you. And so what are some of the common STIs that you and your lab team have been seeing recently?
So the CDC and the World Health Organization has classified about 30 different sexually transmitted infections, but primarily the ones that we see are the human papillomavirus, also herpes. Both of those are caused by a virus. And then we also see bacterial infections, which are things like gonorrhea, chlamydia, syphilis. And I would have to say those are probably the most common ones that we see.
Right, and then you've noticed too some concerning trends too about those here in Montgomery County and surrounding areas with those infections. Can you share a lot more about what your team has been seeing when you have been doing testing?
Sure. So we know over the last several years, we have seen a stark increase in sexually transmitted infections, and that's not just here within our campus. This is within our state and primarily within Clarksville, Montgomery County. So here several years ago, a research study was done that gave some insight into the county statistics, and we recognize that we have the heaviest burden of STI in the state of Tennessee, and when we look at the national average, we are above the mean in our area.
Wow, so that's really concerning. So what do you think might be behind some of those numbers? Maybe something to do with the community or in the area that we're in?
We haven't had any conclusive evidence to point in one direction or another, but there has been a little bit of research done, and it looks like it may be because we have an area that's comprised mainly of younger generations or younger people, and we are in an area that's growing relatively quickly. As you're probably aware, Clarksville has been rated one of the fastest growing areas in the nation a few times over the last, 5 to 10 years.
Exactly.
And so with that comes the need for an infrastructure for health care. And so it's just making sure that health care is accessible to everyone. It doesn't matter socioeconomic class or any of those things. And so our community has been involved with trying to open more clinics that are more accessible to individuals, hosting more health fairs. And that's something that we've also been trying to do here on Austin Peay's campus, is we have been hosting community health fairs. We have started the diagnostic laboratory, which aids in a quicker turnaround time to provide diagnoses for patients who do have STIs.
Right. And so if you're just tuning in, I'm Micah Terrell with 91.9 Public Affairs, and I'm speaking with Dr. Heather Phillips. She's the director of Austin Peay's Infectious Disease Lab, and we were talking about sexually transmitted infections, or STIs, and you and your team are helping us get a better picture of what's happening thanks to your prior work with the COVID-19 epidemic. So talk about how that kind of process happened, where you kind of expanded your work out into working with STIs now.
Sure. So here back in 2020, it was actually the fall of 2020, we opened a COVID-19 testing center to meet the demands for COVID testing in our community. At the time, PCR testing, which was the most reliable testing we had, you're talking about a turnaround time of up to 7 days for the community. By that time, most people are already in the recovery stage for their COVID-19, and so it made treatment very challenging, and people were on a mass level being quarantined for things like the common cold because they didn't know if they had COVID or not. So anyway, we opened the COVID-19 testing center where we tested over 25,000 individuals in our community, and it ended up becoming a huge resource that we began to see the value of having access to a testing lab here. And so it's just kind of morphed into an infectious disease lab, but we're also expanding in other areas as well. So like thyroid testing and other viral testing such as HIV testing, hepatitis C testing, cholesterol testing, hemoglobin A1C testing for people who have diabetes. So lots of opportunities for testing there.
Really cool, yeah. Now take us, the testing for your STIs that you do take several steps, and I understand you mentioned a little bit of it with the centrifuge. Can you take us through, just again, obviously I know you can really get detailed with us, but explain it in simplified terms on how this testing happens.
Well, first of all, it's important to analyze the sample by a properly collected sample. So there are many different methods that we hear patients prefer things that are less invasive. And so if you had to obtain a cervical sample, but there's also options for urine testing or doing a self-collection swab, patients usually try to deviate to obviously the less invasive things. But oftentimes when we deviate to less invasiveness, we're kind of steering away from what we call the sensitivity or the accuracy of the test. So first of all, the sample collection is important because that increases the accuracy of us catching the virus or bacteria or parasite that we're looking for. So don't be steered away from that when you have STI testing with your clinician. Then we go beyond that and it goes into the laboratory, and there's a lot of things that have to be done, and it really depends on which type of testing we're doing. But I believe the testing that we were demonstrating with you was PCR testing, right, which does hold the most accurate method. So we're about 100% with those results as long as we catch it with the sample collection process. So it is a really complicated process, as you saw. That can take about 3.5 hours to perform, but basically we have to purify the sample, we have to collect what it is we're looking for. So if it's a virus, we have to use reagents and processes to select for that particular virus, right? And then the next process would be part of that would be the centrifugation and all of that. And then we have to remove the DNA or the RNA components of that virus. And then we have what's called a probe, which matches, it uses a DNA that's very similar to what you would see in the virus. And as long as it matches together, then it fluoresces, it creates an emission of light. And our instrument detects that and tells us, oh, well, this DNA bound to the probe DNA that you have, so that tells us it's the same, which means that that virus is present in the sample. The problem with viruses is they're so small we can't even see them with a light microscope. So when a lot of people think, oh, well, you can just stick it under the microscope and look for it, but you can't. It's extremely tiny, so we have to use testing methodologies that are usually complex to ensure that we deliver the most accurate sample that we can. But unfortunately, those things are can be expensive, and they do take a while, a longer turnaround time than something like a rapid COVID test or a pregnancy test that you would do at home, which takes about 15 minutes usually.
Right, and so testing is so important, and I'm glad you took us through the steps. Let's also talk about how important testing is for you to do that before you take a treatment, because obviously you've seen the trend where some people are like, oh, well, I'm pretty sure I have this, let's go ahead and get me on this, routine for this certain thing. Stress again how important that testing is for someone to get to solidify what they have.
Sure. So patients sometimes will come in because they notice something that's not right about their body. They'll have drainage or red or tenderness or discomfort or water, urine retention. Something will be going on that they'll seek medical treatment for. And they sometimes will say that they believe they may have an STI of some degree. The problem is that STI is just a broad term. So you can be infected with a bacteria, a virus. We have what we call a unicellular parasite, an organism called Trichomonas vaginalis, which is relatively common in our community. It is one of the top 10 infections that you can get. But we have to delineate between the type of infection because treatment is different, and your long-term chronic chronic treatment may be different as well, because a lot of these diseases, well, infections do develop into diseases that are chronic and are not treatable. So if it's bacterial infection, it's just as easy as giving an antibiotic. But if it's viral, most of the time it is treatable but not curable, and so that treatment plan may look different.
Right, but so important, right, to really solidify
Right.
that. So thank you for driving that home. And if you're just joining us, I'm Micah Terrell with 91.9 Public Affairs and APSU TV, and I'm speaking with Dr. Heather Phillips. She's the director of Austin Peay's Infectious Disease Lab, if I could talk. And we were talking about why the importance of testing for STIs. Now, we wanted to talk about prevention too, because prevention obviously a huge part of this as well. And as you mentioned prior in the segment, that you've done health fairs and there's community efforts to talk about prevention of sexually transmitted infections. So please talk about how important vaccines are as well that we can access early on to help with this too.
So treatment is not available for every vaccine and virus that is a sexually transmitted infection. In fact, there are many infections that you can get that are not treatable at all. And so it's really important that you understand that prevention is the best method. And there are methods that we can do to prevent ourselves. So there are manual methods such as condoms and things like that which will protect you most of the time. But in addition to that, we also have vaccinations. So most people are not aware, but when we talk about viruses, most people don't jump to the conclusion, oh my goodness, I could get cancer. But unfortunately, that is the reality of it. Most people may not be aware that cervical cancers, so we have 4,000 women that succumb to cervical cancer every year. And cervical cancer, 90% of the time, is caused by the human papillomavirus, or HPV, which is a completely preventable disease. We can take a vaccination. We like to usually deliver that before a patient is sexually active, so usually between the ages of 11 and 12. But that doesn't mean if you're already sexually active and you haven't been vaccinated that you can't be. So there are many different serotypes or many different types of HPV, and the vaccine covers a plethora of the serotypes. We have 2 known serotypes which cause cervical cancer, and the vaccine can still prevent other HPV serotypes even if you already have one. So you could be infected with 16, but in the future, if you don't take the vaccine, you could gain additional infections of varying types of HPV. So it's important that you get vaccinated against that if you can. We're in the process of creating other vaccines to help with these other viruses, because at this time, the only known curable virus that we have is hepatitis C, which is also a sexually transmitted infection.
Right, so good to remember that. And again, the HPV virus is available when, like you said, much younger, so
Yes.
you can get that protection early, so it's really important. So Heather, we've talked about a lot of things. What else would you like to share with us before we say goodbye today?
I would also like to put out there that a lot of times people think of HPV as being a female's disease because they think of it as cervical cancer attributed to women. But I'd also like to say how important it is for males to also get vaccinated. For one, later in life, you don't want to transmit that to a counterpart. But you also don't want to spread disease in your community. But in addition to that, over 70% of head, neck, and throat cancers in males are also caused by the human papillomavirus, which again is a completely preventable disease nowadays.
Yeah, very important to remember. So Heather, thank you so much for stopping by. If people would like more information about the work that you do, or if they need to stop by the ARD building is where you're at, right?
Yes, absolutely.
Okay, awesome. So Dr. Heather Phillips, she's the director of Austin Peay's Infectious Disease Lab, and I'm Micah Terrell with 91.9 Public Affairs and APSU TV.